Howdy y'all, my name is Craig Rick, and today I'm going to be talking to you about the Unified Parkinson's Disease Rating Scale. Other known as the UPDRS, this assessment tool is used to diagnose patients who have Parkinson's disease and their progression throughout that disease. In order to perform this test, there are different aspects that you will need to assess, but in the context of this video, we're just going to look at the motor examination portion. In order to test motor examination of a patient, there's a couple things you're going to need to do in preparation. First of all, you're going to need to get some equipment for you. You're going to need some pen, some paper, and a chair with you. If you have armrests on that chair, that's okay. It's going to help us throughout the test regardless. In addition to that, as far as the setup goes, you're going to need a spacious environment, enough to allow the patient to move around and be able to do most of the assignments that you have them tasked to do. And lastly, as far as criteria is concerned, the patient, of course, is going to have to be diagnosed with Parkinson's disease, and they're going to need a trained observer who has gone through this procedure a couple times to be able to administer it properly. With that in mind, there are a couple things that go into the motor examination portion of this assessment. There are a lot of items that we're going to be looking at as far as testing the patient to see how they move in a daily situation almost. A couple of these can be monitored just as you go throughout the assessment and don't need specific tasks associated with them. Those include the facial expression of the patient, body bradykinesia, or the slowing of body movements as they move around, and then posture of the patient. So that's standing up straight like me, so just standing in a forward position versus being hunched over or having an extended back. In addition to those three items, there's a couple other things we're going to have to test for this patient. And a lot of those will involve either standing or sitting positions. For this situation, the first thing that we're going to talk about is posture stability. For the patient, you're going to have them get in a shoulder width stance, and you're going to have them crouch down a little bit. And in this situation, typically you have two people, the observer behind the patient and the patient themselves. Unfortunately, I don't have another person, but I'll still show you. You're going to get down in a little bit of a crouched position, and what you're going to do as the observer is you're going to put your hands on their shoulders, and you're going to pull a little bit. Not enough to create enough force, but you're going to do so to give them a ratio of kind of feeling what that would look like. And then to test this further, you're going to pull progressively harder and harder for about 2 times or 3 times, depending on how you want to assess them properly. From there, we're going to kind of try to see, can they hold a balanced posture while they're getting an outside force upon themselves. In addition to this, one of the other things that you're going to want to test is their gait. When we talk about gait, we're just talking about their step cycle. So you're trying to test whenever they're walking forward or backward. You're trying to test how far their feet get off the ground, the posture as they move through that stance, and anything other related to the walking process. In addition to this, one of the things we're going to test is to see if they have tremors during an active or postural stance. So for example, one of the things that you can do, and it's a very easy thing to do, is you're going to have them extend their arms forward in front of themselves, and then at shoulder width height. And then they're going to take their index fingers and they're going to point them towards each other and then close them in, but don't touch them. As they go through this process, you're going to look to see if they have any rapid movements or extraneous movements as they're sitting in that position. From there, another thing that you're going to want to test is their speech. Now they can be sitting or standing for this, it doesn't really matter, but all you're testing is to see, can they coherently speak without mumbling or without lowering their voice, which are typical symptoms of somebody with Parkinson's disease as they progress through the stages. Lastly, while they're standing, one of the things you can test is their leg agility. There are a couple different ways to test that, but for specifics for today, what we're going to test is to see a certain heel tapping test. Simply that you're going to put their heel out forward with the rest of their foot off the ground, and they're going to take their heel about 3 inches off the ground, and they're going to touch back on the ground, and they're going to repeat this action several times. So they're going to go through that motion. And what you're going to be looking for is essentially, can they perform this action while keeping a natural balance to themselves? After doing these standing exercises, we're going to take them towards kind of a sitting position to kind of test some of their more basic postural things. So we're going to have them go ahead and sit down. And when they sit down, the normal position that we're going to put them in is their legs apart with their arms resting on their thighs. And until you give them a different task to perform, that's the resting position you want them in. Some of the things that we're going to test include tremor at rest, which essentially means while they're sitting in this relaxed position, we're going to see, do they have any leg movements? Do they have any neck movements? Do they have any arm movements while they're sitting? In addition to that, we're also going to test the rigidity of the person. This includes testing the range of motion that each of their extremities, their arms and their legs, as well as their neck can go through. And one of the ways in which we can test that, I'm only going to perform this one today, is the neck rigidity. And to test that, as the observer, you're going to put one of your hands on their forehead and one on the back of their head. And you're going to move their head through extension and flexion to see how far their head can go through a passive motion that you're performing for them. So essentially, you're going to be performing the full range of motion for them if they can do so. In addition to that, one of the positions that we're going to have them go through is hand movements. So essentially, we're just going to have them open and close their hands while in the same position. They can have them raise it off of their legs or on their legs, but they're just going to open and close their hands. They're going to do this as many times as possible for 15 seconds. And then you're going to record that number. The same goes for finger taps. Simply in the seated position or even in the standing position, they're going to take their index finger and their thumb, and they're going to tap them together as many times as possible for 15 seconds. Another one of these tasks involve rapid alternating hand movements. So simply they're going to take their arms back up to shoulder height like they did before in previous tasks, and they're going to take their hands from pronation to supination, back and forth, back and forth. And you're going to be looking at that to see, okay, can they perform that motion without any hesitation or anything of the sort. Lastly, you're going to test if they can rise from a chair on their own. So there are a couple ways we're going to test this. There are 3 typical ways to do so. One of which is to cross their arms over their chest and to stand up on their own. Another one, if they have armrests on the chair, you're simply going to let them be able to use their arms, take those arms, and rise up out of the chair again. And lastly, can they just rise up without any arm movement at all? So arms at their sides, standing up. All of these different items are being assessed on a 0 to 4-point scale, all of which come to the conclusion of whether at a 0 they have no problems, essentially they're normal conditions, or at the 4 end of the scale, we're really seeing they can't really move on their own. They can't do anything of the specifics that we want them to see. Once you've taken that 0 to 4 scale for all these items that we've discussed, essentially you're going to compare them to the Hone and Yard modeling scale, or even the daily living scale. And these will give you either a percentage of their ability to perform daily activities on their own, or it's going to give you a stage progression to see, all right, what stage of Parkinson's disease they're exhibiting from 0 to 5. If you follow all these guidelines and take all of this assessments to its fullest, you'll be able to understand the motor examination of the person exhibiting Parkinson's disease. Thank you.